May is Healthy Vision Month and a great time to make your annual eye exam appointment. Dr. Joshua Mali is here to tell us more about that. How are you?
Hi Elsa, how are you? Thanks for having me on.
I'm doing well and I'm happy to have you here. So, why is eye health so important?
Well, as mentioned, it's a great time to focus on your eye health this month. And ophthalmologists are eye doctors that are able to monitor for these eye conditions. And there's two important ones that I want to discuss that are very common in the retina. One is called diabetic macular edema, or DME for short. And the other one is wet age-related macular degeneration, or AMD for short. And these are two very common eye conditions that are so important to diagnose early because we have great treatment for them and can get patients a better visual outcome.
And what are some of the symptoms of the diseases that you just mentioned?
So typically we see things like blurry vision or distortion in vision. Sometimes in severe cases in wet AMD, for example, we can see complete black spots or loss of vision. And certainly in these conditions, it's so important to diagnose these early. And sometimes in early cases, there's no symptoms at all. So sometimes patients don't have any symptoms or anything going on. So that's why it's so important and so critical to have an eye exam with your ophthalmologist in order to help to diagnose these conditions as soon as possible.
And what are some common misconceptions about eye health?
Just as we mentioned, that you have to have something wrong with your eyes or loss of vision or blurry vision in order to go in to see your eye doctor. And I think that's a mistake. I think it's so important to see your eye doctor on a regular basis. And because of COVID and things like that, people haven't been keeping up with the regular maintenance, especially with eye health. And that's why it's so important in May and Healthy Vision Month that you make that effort to get back on track and stay on a regular schedule with your eye doctor in order to find things, find conditions sooner, and diagnose these conditions sooner to get a better outcome.
And other than an annual exam, what are some easy ways for people to take care of their vision and then prevent eye disease?
Well, I really recommend all my patients a healthy lifestyle. So good diet, exercise, sunglasses are important. And I would say, especially with wet AMD, it's so important to stop smoking. So smoking is a really big risk factor for the progression and worsening of AMD. So I really suggest that all my patients with age-related macular degeneration stop smoking. And in the case of diabetic macular edema, it's so important to control your diabetes. So patients with diabetes, I highly recommend controlling your blood sugars, your blood pressure, and your cholesterol in order to help to reduce your chances of developing DME and to help your whole body, help the whole body system in controlling that disease.
All right. And where can people go for more information?
I highly recommend the American Academy of Ophthalmology website at www.geteysmart.org for more information, and absolutely consult your eye doctor for more information about these conditions and to get that dilated eye exam.
All right, Dr. Joshua Mali, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.